Diabetes is a very prevalent disease in Canada. It affects 1 in 3 Canadians. Additionally, the concept of patient-important outcomes arose in the literature due to the criticism that studies were being designed with outcomes important to researchers but not necessarily relevant to patients. Therefore, our research team asked the question, what do patients with type 2 diabetes tell us about the outcomes important to them, and are these outcomes the same as what physicians rank as important? The setting of this research was an academic family medicine practice in Edmonton, Alberta. We used a mixed method study design. First, physicians were asked to rank important treatment outcomes in order of significance. Second, focus groups were conducted where patients were asked questions about healthy living with diabetes, treatment outcomes, and what was important to them. Physician data was then analyzed quantitatively, while patient data was analyzed qualitatively. 7 physicians and 15 patients participated in the study. This resulted in 3 broad groups of categories of outcomes. The first one is physiologically defined outcomes, and this included prevention of the progression of the disease and avoidance of all major and minor morbidity. The second one was psychologically and socially defined outcomes. This included having better quality of life in general, managing stress, getting better sleep, and having maintenance of functional ability. The third and final one was process highlights, and this included having a healthy doctor-patient relationship, receiving individualized care that was well integrated with the whole healthcare system, and having peer support groups. In conclusion, the patient-important outcomes are actually different when you go out and ask the patients. According to patients, it's not as physiologically defined as once was identified by physicians. Patients focus more on socially defined outcomes and the process to achieve these. Going forward, further investigation is warranted into how diabetes management may be positively influenced by the inclusion of the patient voice in care.